Hi, I'm Jackie Laco, owner of Skye Therapy. I wanted to explain a little bit about our services to you guys. So we offer equine-assisted psychotherapy, which is not riding horses or doing anything like that. It is doing activities on the ground with the horses just to kind of gain insight and make sure that you're aware of what you're putting out to the world. Horses are really nice because what they do is they offer us honest, valuable connection and feedback. So we work a lot with attachments, a lot with ADHD behaviors, a lot with anxiety. Horses are naturally anxious creatures. So, in calming their anxiety, you're also learning how to calm your own nervous system. We do a lot of the neural reprocessing and neural resetting, which is huge in therapy. We are not talk-based therapists, so we use a lot of different modalities like somatic experiencing, the horses, the dogs. And we don't use the horses and dogs, we partner with them. So the horses are always at liberty or kind of free roaming when we do activities. So they always have the choice to come and go, but you're always with a practitioner who's experienced in horses and can keep your child or you very safe. We typically start with the mini horses and then we'll engage you with the larger horses eventually when you feel comfortable and safe. Horses can always be predictable, so there always are risks, but in our whole practice, we've only had little feet get stepped on, and then your foot stings for a little bit, as long as you're in the appropriate shoes. And we just try to make sure we put safety first. So the dog assisted activities are really fun. They focus a lot on connection, attachment, ADHD behaviors, training the dogs, playing hide and seek with the dogs, doing various activities so you can learn how your frustration tolerance is, or what skills you need to improve by doing activities with the animals. We also put some of the problems on the animals instead of the child. So if they have trouble with hygiene, we can kind of work with them through the animals' hygiene, all kinds of stuff we can recreate in the animals and make it a little bit lighter subject. I also have a book that I wrote. I wrote Paws and Puberty, which is a puberty book told through a mother boxer. So it goes through her raising her puppies and then also two children. So it's really cool because it walks you through in a really neurodivergent friendly manner, how to go through puberty and just the basics here and there. We have a lot of clients who we created this book for. And we wanted them to have kind of a lighter step into puberty so they can kind of learn about the basics, but told through a dog. So it kind of puts a lightheartedness to the subject. We also do retreats, which are so much fun and my big, big passion. We do retreats from December all the way through March. And then in the summer, May through September, we do paddleboarding retreats. We are on the river with the wild horses we have beginner and then we have intermediate paddles. And we also have lake retreats at the shallow end of the lake where we work on social skills. And then when I do adult retreats, we work a lot on somatic experiencing. So we might have a somatic experiencing yoga flow in there. We might have some activities that really help you to ground in nature and see a little bit more about yourself and maybe destructive behaviors that you're doing and how to release those. I'm really passionate about some mild trauma. So I really like to work on somatic experiencing yoga and trauma informed yoga with people, either virtually around the US or in person in Arizona. But I really like to work with people on letting go of their anxiety, letting go of their mild traumas through a really nice IFS protocol in addition to the somatic experiencing yoga. I also do virtual yoga at 8 o'clock every Tuesday night with adults just to make sure you guys are kind of releasing anything you're storing as far as stress wise goes. And then we do a little bit of clinical hypnosis at the end. And we also add in some positive affirmations. So when you do certain movements throughout the day, you're actually releasing endorphins and remembering those positive affirmations like I am enough or I am strong. So then your body's kind of reset throughout the week when you're typing and you're doing stuff at work and you get a little bit stressed. You'll also realize how to, change and move your body and reset your eyes just from doing the somatic experiencing yoga. So it's really important just to try different modalities in general because not everybody responds to the same therapies. In our therapy practice, we do 3 sessions just to make sure you're a good fit for us and we're a good fit for you. Because we want to make sure we're not doing these, techniques with you for 6 months to a year that aren't working. There's so many modalities, so many therapists. So I always want you guys to explore different things, see what works, what doesn't work, but then also be honest with us. We are trained art therapists. We're trained in so many different modalities. We can always switch something up We can do ecotherapy. We can do a little bit of CBT if we need to. That's not my favorite. It's the most kind of basic technique that we have used in our practice. But there's so many different things that you can do. So it's really good to just reach out to us and see what we offer, see what you can get yourself involved in, virtually or in person, whatever meets your needs. And then we also offer parent sessions monthly to make sure we're going over your parenting skills and we're meeting with you as the expert of your child, but just trying to help you learn, hey, what can I help you with? Hey, what might be the best technique for this? We're well versed in so many different parenting skills and programs that we don't just do a cookie cutter program. And then if your child struggles in school, we can do a school observation for a couple hours where we go in and we just observe. And then we have recommendations for the teacher. We have recommendations for our therapy sessions. Since we were all teachers before this, we're really good at working with the school system, helping to advocate for your child at 504 meetings within our scope of practice as counselors. So we just try to go above and beyond, but really partner with you guys and help you with whatever you need, especially the autism program. I designed that just to help the autistic kiddos that we work with and the young adults to get jobs, to have job skills if they need to volunteer first, just to develop those skills. We help them a lot in the psychoeducational groups. We help them in the outings, just to make sure we're creating an environment of success. And then we're neurodiverse affirmative therapists. So we want to make sure that we're not putting labels on these kids that much. We're kind of treating some of the labels like ADHD or autism as a different personality type. So we feel like those aren't something that are disease or that are something that's something to be negatively labeled with. I feel like they have a lot of strengths within them. Myself being neurodivergent, having ADHD, I found it's always been a really good gift. And then I can partner with people a lot easier and I have endless energy, which is really fun for me, especially with the horses and the dogs. So if you guys need anything, reach out, ask any questions, but I wanted to give you a little bit more of a recap about what we do.